cause of root canal, one word, neglect. If we choose to neglect an early stage dental cavity, it does progress towards your nerves, and that's when you're gonna need a root canal. So it's very, very important to go visit your dentist every 6 months to get a dental checkup and make sure we avoid getting a root canal. Hi, I am Dr. Marri of Urban Smiles Winford Manila branch. I am their head dentist and I specialize in root canals and all things dental decay. We will need a dental x-ray to try to see what's going on inside our tooth. Because as much as your doctors have studied for long years, it's still different to have all the necessary equipment, photographs, radiographs to see and diagnose you properly. So they are actually very, very important to know exactly what treatment plan is needed for your case specifically. If you're gonna get braces, or if you have braces, the ideal treatment plan is you do your rehab before getting orthodontic treatment. Why is that? When you move teeth, technically you're going against nature and you want everything to be healthy. That means your teeth, your bones, your gums, everything. So right before you step into orthodontics, you have to make sure you're finished with all your root canals. Everything that needs to be done is dealt with. So I would say it's a case-to-case basis as per usual, but if you need it, you definitely have to get it. I always tell my patients it's always a 50-50% chance. The way root canal treatment works, I love explaining it this way. It's like having food inside a jar. If you slightly open the jar, you're gonna allow air to go inside, which will create mold in your food, and eventually that food inside your jar will rot. So what am I saying? The food inside your jar is basically your root canal therapy. You have to have a tight lid just to prolong that root canal. So again, this is 50-50. You can have a really great root canal, 100% made, but if the lid or the filling or the crown outside your tooth is not 100%, you're gonna risk reinfection as well. So I always tell my patients, your treatment doesn't end with just a root canal. You have to pursue other restorative options to make sure that root canal stays as long as we can. So yes, a root canal can last a lifetime if under the right circumstances. But if we neglect certain areas, and there are a lot of factors, your health, your restorative material, etc., this have to be dealt with 100% as well. My number one advice, always choose a doctor that is skilled in what she or he is doing. And of course, consider doing your consultation first before doing any dental treatment so we know if this is the treatment for your tooth and your case. Once again, I am Dr. Marri of Urban Smiles Winford Manila, where beautiful smiles are made.